Welcome back, fellow scientists. So I want to start here, just like we did in the last video, and remind us that reproduction is a blessing from God. Also, I didn't talk about this. I don't think I talked about this in the last video, but God blesses different people in different ways. And a lot of people go into marriage thinking that, oh, reproduction is just going to be no, like we're gonna spend our first couple years preventing that because we have to get to know each other, and we don't want the hassle of dealing with kids and everything like that. Speaking of that, by the way, kids are a hassle. I one of our pastors at our church, he does a family of faith podcast or whatever, and he was talking with a younger couple. They have, I think it's 7 children. The pastor has seven children, but him and his wife were counseling a younger couple who just had their first child, and the wife was like, "When do you sleep?" And the pastor was like, "Oh, nobody told you? You have kids. You give up sleep for at least 18 years of your life." Like, speaking from experience, younger kids, they need to eat. A little bit older kids, they have nightmares. A little bit older kids, they just stay up till all hours of the night and want to talk. And then even probably when they're off in college, I don't know this yet, but even when they're off in college, you're laying up at night, like like awake, like worrying about them, right? What are they gonna? So they're even stealing sleep from you, when they're out of the house. So all that to say that people think that having kids is just going to be automatic, and we need to prevent it. Uh, but God blesses different people in different ways, and many couples struggle with infertility, and some achieve pregnancy and have biological children, and some don't. And God blesses each of us in different ways and gives each of us uh, unique struggles and unique abilities. So I just wanted to kind of put that out there and get that in front of you guys. And then also for you guys right now who are not married, right? So remember, as if your mind starts diving into the gutter, right? Younger men as brothers, younger women as sisters, with absolute purity. So we can talk about reproduction in a God honoring way. All right, so we went through the male reproductive system last time. So let's just, can we move that? There we go. Perfect. So hopefully that you already took your quiz on these diagrams. All right, so now we're going to go through female reproductive systems. So again, the blank notes should be on OneNote, and then whenever you take your quizzes, you can use these open book. Right, so we're just going to dive right in. We'll start right up here at the top. So this, as you can see, this is a mid-sagittal cut, and it's not exactly mid-sagittal, because if it were, then we couldn't see all of this stuff which is off to the side or kind of behind from this view. But this is kind of the classic artist rendition, easiest to see all the structures. So here we have ovary. And then connected to the ovary is this tube, the uterine tube or the fallopian tube, which then connects straight into the uterus. We'll have another picture at the bottom of the slide that'll make all this stuff a little bit more understandable, right? Connecting and holding all this stuff in place, the ovary and the fallopian tube to the uterus, is the broad ligament, right? We're not going to do this line here. This right here is the bladder, right? We talked about God has a sense of humor, right? Disneyland right next to a sewage treatment plant. And this is also funny. I'm told by my wife, who's been pregnant 3 times, that if you're pregnant and you're out in public and you need to go use the public restroom and there's like a line for the public restroom, like pregnant women get cuts straight to the front of the line, and every woman like understands that and knows that, or so I'm told, right? And then also, like if you've ever known someone who's been pregnant and they're like, "Oh, this baby is killing me," and it's like 6, 7, 8, 9 months, like baby's like really moving around and jumping and doing gymnastics and flips and stuff like that, and she's like, "The baby's using my bladder as a trampoline." Like I've heard that before, and no kidding, that's the way that God positioned things, because baby grows here in the uterus, and then notice that as the uterus grows and gets bigger and kind of expands, right, out this way, then yeah, it is possible for the baby to use the bladder as a trampoline. So FYI, God has a sense of humor. And then here we have pelvic girdle, pubic bone, right? Here we have the urethra, emptying the bladder to the outside of the body. We're going to skip these lines. Here is the clitoris. This line right here is the labia minora, or the inner lips. Here we have the labia majora, or the outer lips. And then we'll go back up to here. So then we already talked about the uterus as kind of a general structure. I believe in a previous video I mentioned that it has 3 layers. So this first line right here points to the inner muscular layer. So this is the myometrium. And this is what helps the child to be born. This is what actually contracts and pushes the child out through the birth canal. And this muscle is what's responsible for the legendary pain of childbirth. The outside, kind of the covering, the skin of the uterus is the parametrium. And then the inner layer that builds up and then sloughs off and builds up and sloughs off. And if fertilization is achieved, then this is where the fertilized egg finds a home and will grow for the first 9 months of its life. So that's the endometrium, the inner layer, right? We won't do these 3 lines. This line right here is the cervix. It kind of separates the outside of the body from the inside of the body. It creates a mucus, which we'll talk about in female reproductive physiology. But just know that cervix right there. We won't do that one. It's a rectum, but we don't really care about that. Vagina is right here. Anus is this line right here. And then greater vestibular gland is right here, is that little blue dot right there. So that, like I said, is a mid-sagittal view. So now let's go ahead and let's do the frontal coronal plane. So this is actually from the posterior, but it's still this cut. It's still a frontal coronal cut. So this hopefully makes things make a little bit more sense. So here's the ovary. You have 2 of them. Here's the uterine or fallopian tube, right? Again, 2 of them that connects the ovary to the uterus. We have the broad ligament right here, right? Of course, we have the uterus, we have the parametrium, we have the myometrium, we have the endometrium, those 3 layers, right? And then here's the cervix, and then here's the vagina. So in terms of female reproductive anatomy, that's all kind of, well, most of it, except for the labia minor and major. Most of that is on the inside, right? So then just like we did with the male reproductive anatomy, we kind of took a look at the outside reproductive structures. So we'll do that same thing with females. So technically, all of the outside reproductive structures of a female are called the vulva. Right, so here are the different parts of the vulva. So we have the mons pubis, which is kind of like a fat pad. Males have it too, but it's more pronounced in females. The prepuce of the clitoris. So remember, the prepuce in a male was the foreskin, and sometimes removed by circumcision. Some cultures will actually try to do female circumcision, although that is not widely practiced at all and is seen as a form of sexual harassment or genital mutilation. This right here, this whole kind of inside the inner lips or inside the labia minora, but then not inside the vagina quite yet, that's called the vestibule. And then, of course, anus. And then back up top here, we have labia majora, right? So the outer lips, labia minora, inner lips, urethral orifice. So that's where urine exits the body, right there. Hymen is a flap of skin. Some females have it, some females don't have it. Sometimes it breaks before first sexual intercourse. Sometimes it breaks during first sexual intercourse. It used to be thought of as like the main signifier of virginity, but now that we're learning more, now that's kind of gone by the wayside. And then here, of course, is the vaginal orifice or the opening to the vagina. And then here are the openings of the greater vestibular glands. This is what the vulva looks like if we remove all the flesh and all the muscle, and we can just see kind of the glands and the bone and stuff like that. And then I already talked about this, so I won't go over this again, but it's just really interesting to note that 7 weeks, males and females look the same. And then the way that we get our different reproductive structures is just by hormones. They're made from the exact same tissue. So labia, scrotum, glands of the penis is clitoris of the female reproductive anatomy. So that's it for today. Again, we're going to have a quiz on Friday. Oh, sorry, wrong way. And then next week, we'll get into physiology of the different reproductive systems. So this has been Mr. Leo. Hopefully this has been educational and informative, and I will see you on the flip side.